Hi, I'm Dr. Melissa Balizan. Welcome to Take Charge of Your Health. Today I have with me Dr. Lauren Castle. She's a functional medicine pharmacist. Welcome, Lauren.
Hi, thanks for having me.
Excellent. So let's get started. Let's kind of break that down. What actually is functional medicine? Because that's a big word.
Yeah, functional medicine is sort of a newer upcoming field. So you might have heard of things like integrative medicine or integrative health and wellness. And functional medicine is integrative in that it looks at a lot of different modalities or ways that you can treat disease or illness. But the difference is that it really focuses on the root causes of disease or imbalance in the body. So we'll get into some examples of how that might look whenever you are a patient, but essentially it's not just accepting, a pill for every ill or thinking that we're just going to treat the symptoms and kind of cover it up but never really understand what's going on. It's really getting to the root cause so that whenever you say, something just doesn't feel right, it's because something's not right and you have to find out what that is. And sometimes it takes a little bit of digging to do that.
I love that. And I really, as pharmacists, we have heard the term pill for every ill, and I think a lot of patients have heard that as well. And to me, it's like we're putting a band-aid on something. We're not really digging down. So I love that the functional medicine is digging down to that root cause. So tell us how you actually got involved. What steered you down that path? I mean, as a pharmacist, that's kind of opposite direction. I mean, I have a similar thing. So tell us your story.
Yeah, absolutely. So I've been a pharmacist for, 7 years now, and I've been working in pharmacy since I was 17. So it's always been my passion and something I loved, and have, an amazing career as a pharmacist helping patients. But we moved a lot, my husband and I, through our careers together. So when we moved up to Michigan, this was about 5 years ago, he was having some health issues that we really couldn't quite get to the root of. And so I was very into fitness and, eating healthy, or so I thought. We were drinking the skim milk instead of the 2%. We were eating the whole grains, the whole wheat instead of the white bread, those types of things that were taught from mainstream nutrition, right?
Yes.
But we just couldn't quite figure out what was going on. He had a lot of sinus issues and digestive issues, some issues with sleeping, all these kind of generic symptoms that I was like, if you go to the doctor, they're just going to give you some antihistamines or a sleeping pill or, something to just temporarily fix those issues, but it's not going to figure out what's really wrong. So we ended up finding an integrative wellness center that practiced functional medicine. And so we tried it out, and I was very skeptical. I was like, I don't really know about this functional medicine stuff. This seems, I'm reading on Google that it could be pseudoscience or, that it's quackery. But then I read some other articles that, Cleveland Clinic is actually launching a functional medicine center, which, at that time, coming from Ohio and moving to Michigan, it's like, Cleveland Clinic is doing something, it's a big deal. So that was kind of enough for me to say, like, all right, well, there's got to be something to this that's evidence-based, and that's what it claims to be. So let's see, if it works. And so he went through this 12-week program. We actually found out through some really extensive lab testing, which is something that is very common in functional medicine, is to test and not just guess, that he had gluten and dairy sensitivities. So all of that whole wheat bread and skim milk that we thought we were doing good drinking and eating was really fueling this inflammatory state that caused all of these different symptoms that seemingly were unrelated and truly all had one root cause, which came down to that inflammation. So for me, watching over just the course of a couple months, being able to, lose that 20 pounds that had just been so stubborn for so long, and being able to sleep, me being able to sleep because, we were both able to rest. It was just amazing to watch. And I thought to myself, this is the future of medicine, something that every pharmacist needs to know and every patient should know about as well, that there's a better way, and it doesn't just have to be covering it up with pills and medications, that you can really change your lifestyle and it can reverse some of these conditions that we didn't think was possible.
Absolutely. And that actually that's a perfect segue into my next question. So, you know, it's the future. It is the future. And I think it's the future of a lot of healthcare professionals and us being able to collaborate together. You know, we've kind of had a model, a similar model, you know, the patient's in the center and we're trying to collaborate, but it's not quite there yet. I mean, it's working on getting to that integrative and functional state. But so how can a pharmacist, a functional medicine pharmacist, actually, you know, help the patient really give us some tools to, you know, really take charge of our health?
Yeah, I love the name of this summit being Take Charge of Your Health, because that is truly what functional medicine is all about. It is a partnership between the patient and the provider and really understanding, what is it going to take to get these changes to start rolling. It's not just walk into an office and, have a provider talk at you for 5 minutes and then write you a prescription and out you go. It's truly a partnership, and that partnership extends to, like you said, the whole care team. And so with pharmacists, this is a really unique opportunity that we have to kind of reshape and take charge of our own profession, in that, we can look at all of the things that maybe are broken in the pharmacy model today. Drug prices are tremendously expensive and cost prohibitive for so many patients. There's side effects that people have to deal with. There's interactions that happen all the time. So a pharmacist that can go through that functional medicine lens can really help to kind of course correct. And especially if you're a patient who is on medications, on prescription drugs, it's really important not to just quit them cold turkey. You can have a lot of really negative impact to your health if you're not careful in the way that you stop taking medication. So that's sort of my favorite thing that I think a functional medicine pharmacist can do, which is what we call deprescribing. So deprescribing is the act of carefully and in a very controlled manner de-escalating those doses of medications in a safe way by looking at if it's still having an effect, if it's having negative effects, if there's, a safer alternative that we can use, and really just lessening the total amount of medications that a patient would need to be on. So deprescribing is one tool, and that can often take place in the context of what we call medication therapy management. So that's a more holistic approach to looking at all of the medications that a patient could be taking, including supplements, and then looking at all of the conditions that they have, making sure that if you're taking a medication, it's the right one for you as an individual, for your particular disease state, and really optimizing the use of those medications. So in the process of doing an MTM session, there's some other things they could look at as well. So we talked about supplements. So this can kind of work both ways. For some patients, they could be taking lots of supplements, just like they might be taking lots of prescriptions and not really knowing which ones are working, which ones are not working, which ones could be causing side effects, or which ones could be causing interactions with other medications or other supplements. So that's one thing that we can do, is to look at those different interactions. And then kind of the last area is if you're on prescription medications, maybe you're not taking any supplements, these prescription medications can do what we call drug nutrient depletion. So what that means is that certain medications are known for depleting the nutrients that your body needs in order to function. So a common example is patients who are taking metformin for their diabetes can be deficient in vitamin B12. So this could be really problematic for some patients, because oftentimes diabetic patients or people with diabetes will have things like neuropathy, where you get that pins and needles and tingling in your legs or your extremities. So the challenge is that neuropathy caused from a B12 deficiency, or is it because of the diabetes being uncontrolled? So knowing, if we're supplementing with that B12 and ruling that out and making sure that we're having the right amounts of those nutrients can be really important. And the list goes on and on. There's so many medications that have drug nutrient depletions. It's a really important step to talk to your pharmacist about that.
I love that, and that is so true, and that's something that uh, it's hard for people to understand because they're just given a prescription and they don't realize, they might say, okay, well, there might be a side effect, or there might be this, there's that drug interaction, but the fact that it can actually be pulling essential nutrients out of our body has not been really thought of until recently, until functional medicine has really taken a role. So I love that, if you can talk to your pharmacist about that, that's wonderful. Let's also talk about, so if you are depleted in a certain supplement, um, how to make sure that you're getting a good quality supplement.
That is a fantastic question. So, not all supplements are created equal. Now, when you go into a typical drugstore or grocery store, you'll see rows and rows of vitamins and supplements that are out there. So, there's a couple things you can do to kind of look at, your typical kind of entry level vitamins on the shelf and make sure that, at the very least, they're safe. So, with that, you're looking for things like USP, which is a little symbol that indicates good quality, or you might see good manufacturing practices, GMP. So those are some symbols that you might see on certain brands of medication or on supplements that indicate the safety aspect of it, the very minimum. But what we also want to look for is, especially with vitamins, if they are active ingredients. So for example, we talked about things like B12, which is cyanocobalamin, is what most B12s are that you see on the shelf. But a functionally trained pharmacist will ask more questions and kind of understand, could you be someone that has a genetic insufficiency where cyanocobalamin doesn't work that well for you? So I know for me personally, after looking at my genetic data, I'm one that doesn't do so great with that one. And so I have to look for methylcobalamin, which is a different form of B12 that's much more impactful and effective for me. So again, we talked about if you're going to use supplements, you want to make sure you're getting optimal results from them. And that's going to come from having that discussion with your pharmacist. So, kind of the last aspect of choosing quality supplements is that there are many brands that are provider specific. So, you can't just go buy them off the shelf at your typical grocery store. And so, with those, you can access them through a provider who has maybe an online dispensary, something like FullScript or Wellevate or Common Examples, which we can actually send everyone a link to as well after this summit if they're interested in looking through some of those more higher quality supplements.
I love it. I love it because, yeah, I mean, that's the key is the purpose of this summit is to educate, and to really educate you on how to take charge of your health. And those are great tips, on supplements right there. So let's go back to both of us, we want to decrease chronic disease. And so let's talk about what you would want your pharmacist, what would you want to talk to your pharmacist about? Then let's see, what you want your pharmacist to know about you for, when you're trying to lessen that diabetes or lessen any other chronic disease as a functional medicine pharmacist.
Sure. So, I think one thing is really understanding the impact of lifestyle and the power that lifestyle changes can have. So, I've worked in grocery store pharmacy chains for a number of years, and it's always really interesting when patients would come up to the counter after they've done their grocery shopping and they're just picking up their metformin or their diabetes medications and, trying to make their way out of the grocery store. But I can see everything that's in their cart. And so, one really helpful tip is to be open and honest with your pharmacist. And if you're a pharmacist, to ask those questions to your patients. So, talk about things like nutrition. What does that look like for you? Do you understand what types of foods have an impact on your blood sugar? Do you understand that fats aren't necessarily the devil anymore and that they can actually be really helpful and healthy in regulating your blood sugar? So talking about nutrition is probably one of the most important things when it comes to managing most chronic conditions. There's a nutritional component to it. Other things that you would want to look at as well include things like your exercise habits, and it doesn't have to be, running on a treadmill for an hour every day. We're talking about movement in general. That can be really helpful for not being sedentary. So just not just sitting all day, but getting up and moving and kind of incorporating that into your day. We also look at things like sleep. So sleep can be really impactful as well. If you're not getting enough, your body's not going to be able to heal itself properly. So we talk about sleep hygiene. That's something else that you can improve, where you make sure you're powering down your devices at night, you're getting rid of that blue light, you're trying to relax into your evening, those types of things that can be really helpful to de-stress and kind of ease into your nighttime routine. So all those different lifestyle changes are all things that, should be a discussion when you're talking about your health and you're looking at improving and taking charge of your own disease states and conditions to find better health.
That's excellent. That's excellent, Dr. Lauren, because those are things that, we may not even think about. That's a simple step we can do. Just power down our devices and get rid of some of that blue light. It's going to help you to be able to sleep, because so many of us, we're on a computer, we're on a tablet, we're on our phone almost 24/7, it seems like these days. So really having that time to power down. So let's talk, those are some great tips, all of that around, decreasing chronic disease and trying to, get you down to the bare minimum of the medications that you need to be on, whether it's prescription medications or it's a supplement that you need to be on. But let's talk a little bit about the mental wellness, the mindfulness aspect of how that can affect you, and how you need to be open with your functional medicine pharmacist about that.
Absolutely. So there's been a lot of studies on the power of placebo, and basically, just having that mindset and that intention that you're doing something that's good for you and that's going to make a change, that alone can actually create change. So we talk about mindfulness, and, meditation is one example of how you can kind of increase and improve your mindfulness, but it doesn't have to be, a really long period of time for that either. It can be, just a few moments when you wake up in the morning that you sit up, you think about what you're grateful for that day. And, especially if you're someone that does have a lot of chronic conditions, we know that a lot of people can suffer from depression right alongside of that, because it's so much to try and manage. It can be very overwhelming. You might feel like, no one's really listening to you and understanding what you're going through, and feels very hopeless for a lot of people. But, hopefully if you take away anything from our talk today, it's that you can take charge of your health. And a lot of it does start with that positive mindset and understanding, what small changes can I make today that's going to add up over time? Because it's not going to happen overnight. You didn't develop diabetes overnight. It happens over years. And guess what? It's going to take years possibly to really ultimately reverse those types of conditions. But you'd be surprised how much can really change whenever you do start to adopt some of these different lifestyle changes, and what I call minding your meds. So we've talked about mindfulness, exercise, diet, and sleep. So those are your other meds that you want to think about every day to create that lifestyle change, and just kind of, focus on one at a time as you're getting started. But, over time, you'll be able to adopt all of those different habits. And that's where you really start to see the change that will last. It doesn't just, come back whenever you have stopped these behaviors. It's something you can really continue with for the long term.
I love that. I love that. And those are simple steps, the tag of the summit, simple steps you can do today. So you can pick something out, pick one of those. Don't try and do them all at once, because that's gonna lead to you not being as happy. But pick one thing, start it, do the next thing, for a few days. And then when you feel like you're doing that consistently, add something else on. So those are all great tips that you've been giving us. And Dr. Lauren has a special offer for us, and there'll be a link listed either above or below. I'm not sure which part is going to land above the video or below the video, but it'll be a Take Charge of Your Health / Lauren. And so tell us a little bit about that special offer that you're gifting today.
Yeah, so I really wanted to create something that was a simple guide to 5 tools that you can use as a patient when you're working with your pharmacist, or vice versa. If you're a pharmacist and you're new to functional medicine and you're thinking, this sounds amazing and I really want to be able to help more patients using this type of process, but I don't know how to get started, It'll just be a nice summary tool that you can use to take to your appointments or to hand out as a consultation tool, as kind of a recap and a reminder of all the amazing things that we talked about today. And we can also include, like I said, a link to some of these high quality supplement dispensaries so that if that is something you are interested in, you can also make sure that you have access to those as well. I'm really passionate about affordable, accessible functional medicine healthcare. And that's one thing that, thankfully through summits like this and the power of the internet today, people do have access to this type of knowledge and education and, supplements and things that can improve their health. And you don't have to, jump through the hoops much like we used to in that healthcare system. You can really take a lot of steps on your own today.
I love it. Thank you so much for that. And thank you for all of your intelligence and insight today, because that is, I do believe this is the future. This is where we're going. We're trying to get to the root cause and trying to actually, decrease these chronic diseases and decrease, those that have it and those that are getting them. And I really believe functional medicine is definitely on the rise and the way to go. So I want to thank you for being here with us. I really appreciate your time. And I just wanted to ask, was there anything else you wanted to add today that we haven't discussed already?
No, I think we covered it all. This was, an amazing opportunity to come on and talk to everyone today. So I hope everyone finds it valuable, and I certainly look forward to connecting with many of you online after the summit.
Excellent. Well, thank you, Dr. Lauren, and thank you everybody for watching. Once again, this is Take Charge of Your Health, simple things you can do today to take control of your physical and mental health. Take care and have an amazing day.